Our job every day is to lay out the facts of a given story, share what we know and what we don't. We recognize the dramatic daily updates in aggressive COVID-19 coverage can spark fears, frightening headlines, social media speculation. Maybe you've seen it in a worried text from your mom. I have. We're all in this together. You can count on WBIR to help you navigate your way through all of that with facts, not fear. You have our promise to be realistic and rational in our coverage. We will bring you facts and answers from trusted sources, local, state, and national. We value your trust, and with your input, we are working to reinforce it every day with our reporting on air and online. Thank you for joining us. We're going to set the scene with some of the basic facts. There are 18 confirmed cases in the state of Tennessee, one of those cases in Knox County. There are cases in 41 states. About 4,700 people have died worldwide. More than 68,000 people have recovered. You can send us your questions right now. We are answering as many as we can during this live broadcast. Text them to this number, 865-637-1010. Now, dozens of you have been sending questions throughout the day, and here to answer some of them, Dr. Jennifer Urbano from Trinity Medical Associates. We appreciate you joining us, Doctor, and let's get straight to it. Our first question of the day is, what underlying conditions make you more likely to have a serious COVID-19 case?
So the cases that we've seen so far that have been more serious, the CDC has reported, are patients that are of older age, so age greater than 60, as well as having other underlying medical conditions such as heart disease, chronic lung disease, and other immunocompromising conditions such as cancer diagnoses and the like.
Let's move to the next question now. If you recover from COVID-19, can you get it again?
The numbers are still being looked at for this. Most viruses can mutate, and so there can be different strains of viruses. So theoretically, it may be possible, although we haven't seen cases of that to my knowledge. Our next question from another viewer: if one contracts coronavirus, how long is its course from start to finish? No one is explaining that information. It may take weeks for full recovery, just depending on how sick the patient is and their age and their comorbidities, i.e. Their underlying health conditions. But it may take at least 2 weeks and up to 6 weeks and even longer in some. Let's move to Ashley Corker's question. What are the symptoms? What should you ask your doctor to test? Fever, shortness of breath, and cough have been the characteristic symptoms so far. We are ramping up testing in the United States, so it should be done on a case-by-case basis, and also in looking at how sick the patients are and what their general health is on who we will choose to test. Again, these questions from our viewers. The next one: will COVID-19 always have fever as a symptom? What we know currently, most of the patients are presenting with fever as a characteristic symptom. All right, next question from our viewers. Can antiviral medications lessen the severity of the COVID-19 if or when we get it? There have not been any case reports to my knowledge on this. There have been some antiviral medications that have been used, but there are none that are FDA approved right now, and I'm certain that there's something that they're working on. Next question: are there other types of coronavirus that have been around and are not COVID-19 that we have likely been exposed to for years? And would you say you have coronavirus, but this is not COVID-19? Are we going to hear that from a doctor? So there are 7 strains of coronavirus. This new strain is the 7th strain that we are aware of. So yes, there have been others that we've seen throughout history. Yes, that's correct. Has anybody gotten this virus and lived, or is it terminal? The majority of patients have mild illness from what we are currently seeing. And really, to emphasize that, it's some 80% is what we understand, correct? That's correct. Okay. Next question: what are the possible long-term effects on your health after you've recovered from the virus? For example, will there be long-term lung damage such as fibrosis? I think that some of this is still left to be seen as we are able to follow patients following their recovery. We need more data. We do. We really do. All right, next question. What makes the COVID-19 virus more deadly than the influenza virus? I think the initial numbers that are coming out seem scary because the mortality rate does seem like it's between 2 and 4% in some of the reports that we are getting. Seasonal influenza, the mortality rate for that over the last 10 years has been about 0.1%. And I know those numbers seem very stark in contrast, but we also have readily available testing for the flu, and that's not been the case for the COVID-19.
And doctor, do you think as we get more data, we'll be able to understand it even more and we'll see that fluctuate?
I'm hopeful that the mortality rate will be less because more testing.
All right. I have a 5-month-old infant at home. How susceptible is he to the virus? What should I watch for, and how worried should I be?
The symptoms that children are exhibiting for this seem to be similar to what the adults are exhibiting. So again, fever, cough, and shortness of breath. Kids that are extremely young, say less than 4 months, we worry about their immunity and their ability to fight infection just in general, not necessarily specific to COVID-19. I do think that there is some promising data that children have been less severely affected by this, so that is very encouraging news.
Doctor, just as a timeline before we move to this next question, I heard one infectious disease expert talk about this as a way of us thinking about it as a blizzard. We want it over in a week or so,
sure, but
we should be thinking about it more as a winter, where it may extend into months. Is that fair?
I think I've heard some of our experts talk about months to years potentially, and that the numbers may very much vacillate over the next several months.
This question, what are the chances of miscarrying for a pregnant woman who has the coronavirus?
There is very little data on the coronavirus in pregnancy, so I do not know of any cases that have been attributed to coronavirus and the COVID-19 for a miscarriage to date, but we will continue to monitor that closely.
Dr. Jennifer Urbano, we appreciate your expertise.
Thank you
for joining us tonight, and thank you to our viewers as well. Just to note here, the Knox County Health Department did give an update on the coronavirus to answer some of your questions today, and 10 News reporter Grace King joins us with what we've learned from them.
We know you have a lot of questions, like a lot. We heard from some of you around Knoxville today and took your questions straight to the health department.
How long should we worry?
Here's what they had to say.
What are they trying to do as of a cure for it?
When is there going to be a vaccine for it?
Well, there's no vaccine or treatment yet. I know that lots of really smart people in labs all over the world are working really hard to develop either or both of those.
Do I have the flu or the coronavirus?
If you have a respiratory illness, fever, cough, right now in Tennessee, you're more likely to have the flu than you are to have coronavirus. That being said, give your doctor a call and let them know that you have these symptoms.
Should you be tested for the coronavirus even though you don't have symptoms?
You don't need to be tested for coronavirus or flu because you're not sick.
Is there any other precautions that we need to take?
The things we can do now will reduce risk later. Recommending people be thoughtful, people practice good personal hygiene, and good personal choice.
In regards to coronavirus, how safe is it when it comes to eating out?
Restaurants are safe to eat in as long as everybody's following hand hygiene and keeping the food safe, and people are staying home if they're sick.
The best advice the health department has right now is being alert, aware, and diligent, and of course, staying home if you're sick and washing your hands.
Grace King with that angle. Grocery stores, we know, are starting to run out of some items, but do you really need to stock up? Let's verify. One of you text us, do I need to store up food and water? To answer that, we went straight to the CDC and Red Cross. The CDC only recommends stocking up on food if you're planning to care for someone who is elderly. The Red Cross suggests having food staples on hand. Here's the thing, it's incredibly unlikely that stores will shut down or that you'd lose access to food. The real question here is if you would want to leave your house to get those things. If you'd rather hunker down until this blows over, well, you'll need enough food to do that. Oh, and as for water, don't go buying a ton of bottles. This isn't a hurricane or flood where we have to worry about the water cutting off. As more information about COVID-19 is put out there, some people are certainly feeling anxious, and here to talk about that and how to cope with it is Dr. Melissa Rose, who is a professional therapist. Doctor, we appreciate you joining us. Let's talk about the anxiety connected to this outbreak, especially today. Cancellation after cancellation after cancellation, that ramps up our anxiety.
Absolutely.
What to do?
Yeah. Definitely taking a breath. taking a moment to collect ourselves, because all of this information is definitely overwhelming. Go to the facts. You know, get your facts from the source. I think knowledge is power in this type of situation, so we want to make sure that we are really arming ourselves with the proper information. That way we're not having the fear that's coming from improper information.
I've talked to some of my colleagues today about this 9/11 feeling, that life is not going to be the same after what we've seen.
Right.
It's a different feeling, but it's sort of similar in that.
Right.
How do you help control panic as a person, and so that you don't spread it among others?
Yeah, so there again, making sure you know the facts, making sure that you're not spreading inaccurate information, definitely getting prepared and making sure that, you know, there's a difference between being panicked and being prepared. And so just making sure that you're preparing yourself, taking proper precautions that are being suggested by the CDC, for sure.
Perhaps one of the most important questions, how do we talk to our children about this?
For sure. So that is number one, that is the key, is talking to our children. So, you know, we don't want to leave them to be left in the dark. They need the information, they do need that conversation. You want to come to them with the question of, you know, hey, how are you feeling about this? Do you know what this is? And then let them kind of lead you through that. You don't really want to give them too much information and present, you know, more anxiety for them, maybe information they're not prepared for. So definitely see how much they know and then kind of go from there.
It's age specific too.
Absolutely.
Doctor, we appreciate your expertise.
Yeah,
Thank
absolutely.
you.
Thank you.
We're going to be continuing to answer your questions throughout this live broadcast. Again, text those questions to 865-637-1010. We'll get to as many as we can. As we head to break, here is a quick answer to one of the most popular questions people are asking. Yes, it is safe to receive a package from an area where the coronavirus has been reported. The World Health Organization says there is no evidence that the virus can travel on mail. Viewer Noelle M. asked us to look into garlic and onions, namely why people seem to be rushing to buy both. We did some research and found a number of articles talking about eating garlic and onions to stave off sickness. Some of them are merely highlighting healthy foods to boost our immune systems. Others seem to claim that garlic has a special property that can protect us. It doesn't. The WHO debunked that idea. It may be a healthy food, but garlic has no special power against the new coronavirus. And this just in, Knox County Schools is closing tomorrow, Friday, just ahead of spring break. They're doing that to get an early start on cleaning school facilities. We're going to move on to a conversation about coronavirus online, and joining us to talk about the impact of social media, Dr. Tricia Bruce, who is a sociologist. Doctor, we have seen a lot of wildfire-like spread of this online. Tell us a little bit about what you recommend to our viewers when they do go online.
Yeah, absolutely. I mean, we've heard already from some of the experts up here that it's really important to separate fact and fiction. WBIR is doing a great job of that. I mean, the first thing we want to ask ourselves is, what information are we reading? Where is it coming from? Because the risk is that we get amped up with fear and panic, and some of that is irrational, or it's just based on lack of knowledge when we're still waiting for more information.
Let's get a little perspective on this historically as well. Ebola, SARS, swine flu, we have seen other outbreaks in the past. The Spanish flu almost 100 years ago. 100
years ago, when we didn't have Facebook, we didn't have Twitter, and sure, there were different kinds of fear spreading throughout a community and different forms of communication at that time. Now we have the power in our hands of being able to talk to everyone around the world. This is a wonderful thing, right? This is a tool to be able to respond to this crisis. And yet it's also a way to spread fear and misinformation, so we have to be really careful about how we support each other through that.
Trusted sources right now, perhaps more important than ever. You talk about the social distancing question. Explain what you mean by that as a sociologist.
Yeah, you know, part of what this is helping us to recognize is how deeply interconnected we are. And when we're hearing experts recommend social distance, some of us get a little antsy, right? What does it mean to be disconnected? But it doesn't mean social isolation, for one. And in fact, this is the power of social media, that we remain connected. And for those at-risk populations, we may want to think about who's in our own network that we can help, that we can reach out to, because in fact, we are still connected. We need to be connected. The solution does not come from I, but from we.
Even a phone call, a FaceTime can go a long way.
Absolutely, and doesn't involve handshakes.
Dr. Tricia Bruce, we appreciate your expertise. Thank you for being here.
Thanks so much.
Coming up on our special, many of you are looking for more verification about this coronavirus. Here's more. This viewer texted about the risk of getting infected from public bathrooms that weren't cleaned well. We went to the CDC to verify this one. 2 quick points. Yes, they have detected the new coronavirus in the feces of some patients, but they don't know how long it can survive there. It's important to remember you can't just get the virus from touching infected feces. As gross as it sounds, the virus still has to make it to your mouth and then respiratory system. So, yes, the virus can be found in poop, but as long as you wash your hands and avoid touching your face, it's not going to infect you. We're back with Dr. Jennifer Urbano. Again, she is a physician and taking more of our viewer questions. Let's get to a lot of them because many of you have been texting them to us. I have multiple sclerosis. Am I at risk more than most people?
I think that's a question definitely that you should undertake with your physician because the scope of multiple sclerosis is so broad. Any immunocompromising condition or anything that requires you to be on steroids long term, we would consider immunocompromised, could potentially increase your risk.
Next question, is the test for COVID a blood test? How does it work, doctor?
Yes, there have been some confirmation. There's a nasopharyngeal swab actually that we are doing. Those are not commercially available to my knowledge at this moment. And speaking with the Knox County Health Department today, there are some commercial entities that should make those available to us end of week or early next week.
Could you explain that swab for us?
Yes, so it's a swab that basically goes up your nose, and it allows us to test for the presence of the virus. And they are swabbing patients after symptoms have resolved to determine if they're negative. And I believe at this current time, there's 2 negatives 24 to 48 hours apart that are required to consider a true negative.
Okay. If someone could have been exposed in, say, another state, but is asymptomatic, should they stay home? Also, how long is someone contagious after they infected? 2 questions there. How long should they stay home if they might have been exposed but they're asymptomatic? Let's start there.
The current recommendation, if there's a quarantine recommended by your local or state or federal health authorities, is 14 days. And as far as being contagious, typically after that 14-day period, if you were exhibiting no symptoms, the risk is very low that you would go on to have symptoms.
Okay. We're going to move on to another question. Again, these are coming for our viewers, and I understand that corona is carried by the air. Can my pet carry it into the house like she carries in pollen? And I think we need to clarify that question about the air, because we've heard from the health department today, you can't just get it walking around. You're not going to breathe it in that way.
Right. It's definitely transmitted via respiratory droplets, so a cough or a sneeze of some sort. And for our pet lovers, the good news is that the CDC and WHO are saying that you cannot get this from your pets.
That is a relief.
Yes.
Are children susceptible to catching the virus? That was similar to a question we had earlier.
Yes, like any virus out there, children are susceptible. The good news is that we are finding that children to date have been having the mild cases.
We have about 60 seconds left to get to a few more questions. What medicine can you take, like over the counter? Is that an option?
So there are medicines that you can take over the counter for just the symptoms that you're experiencing for cough and fever. Your run-of-the-mill Tylenol and ibuprofen. I would say to check with your doctor, because if you have pre-existing liver or kidney conditions, the recommendations might be different for those patients. Cough and cold medicines are also something that might help alleviate some symptoms. But again, if you have high blood pressure or other complicating medical factors, it would be a good idea to talk to your doctor about specifics.
What are risk factors, again, for pregnant women? You covered this earlier, but it's worth underlining.
Yes. So pregnant women are more susceptible to getting viruses in general, not necessarily COVID-19, but just as a general statement. And they are at risk of getting sicker quicker with these viruses. So the same guidelines exist currently for helping to prevent spread and what they should be doing at this time to prevent getting it.
Doctor, at the end of our conversation, help us take a deep breath. How can you reassure us, and how are you reassuring your patients?
You know, there is a lot of panic, and I think the fear of the unknown is very great right now. I understand that that is something that can be very fearful to just not know, and we're waiting for information, and information is constantly coming at us. As the other two doctors had stressed, I think it's great to make sure that you have appropriate and accurate information, and I would just encourage you to just take a deep breath. You know, this is a virus. We don't know exactly how this is going to pan out, but all of it, we can do the things that we can to help prevent. So washing your hands, covering your cough, staying at home if you're ill, those types of things go a long way. And I will say too, for my own personal family and for ourselves, prayer, stress management, lowering your stress, those types of things go a long way.
Doctor, thank you so much for joining us. We
Absolutely.
appreciate it. We're going to turn now to Jason Puckett, set out to verify what's true and what's not.
The coronavirus is serious, so we're focusing on facts, not fear. We're tackling 4 of the biggest coronavirus claims this week. Did you see the post about a whiteboard outside a doctor's office? It said there's a major outbreak every election year and that this was actually a political thing. We checked with the CDC and WHO. The whole board is false. The years are either wrong or cherry-picked. SARS was contained in 2003, for example, not 2004. Also, the CDC and WHO respond to a list of outbreaks every single year. The right side makes more false claims, like saying the spread is leveling off. The spread is slowing in China right now, but other countries, including the US, are seeing a steady rise in cases. So claim false. What about this list of 5 tips for hand sanitizer? Overall, it's a decent list, but you should ignore number 2 completely. It says hand sanitizer needs to sit on your hands for 3 to 4 minutes to work effectively. That's not true and would waste a lot of sanitizer. The CDC says about 20 seconds should do the trick. Rub it all over your hands, and since it's alcohol-based, it should dry pretty quickly. Our third claim came from Twitter. It's been deleted but is being reposted on multiple platforms now. It talks about a coronavirus loophole. If you can't afford to be tested, you should just go donate blood because they test for the coronavirus. This is not true. We checked with the Red Cross and America's Blood Centers. Since the coronavirus is so new, they don't actually test blood donations for it. So A, this wouldn't work, and B, you'd be putting donation center workers at risk if you were sick. That's a big deal because there's actually a nationwide need for blood donations right now, and posts like this could scare people away based on false information. The last claim this week comes from headlines about the surfaces the virus can spread on. Can you get it from money, phones, pets' fur? The quick answer here is that the coronavirus can survive, at least briefly, on almost any surface. The WHO estimates it can live from a few hours to several days depending on factors like temperature and humidity. But here's the thing. The virus being on a surface doesn't get you sick. It has to get into your respiratory system. These articles and stories are drawing our attention to specific surfaces, but the reality is we should just be aware of all surfaces. Thankfully, the prevention is the same for all of them. Wash your hands and clean the things you're touching a lot. If you take those precautions, there's no reason to be more concerned about one surface over another. If you see more claims like these out there, send us an email. We'll look into them. With your Verify, I'm Jason Puckett.
And just to underline what our doctors have been saying this afternoon, it is important to be informed, but equally important to stay calm. More than anything else, it's important to do our best to stay healthy. And on that note, we're going to take a minute to wash our hands, and we'll see you next on 10 News at 6.